David Mason, the Director of Public Health for the town of Sandwich. It is PSA number 16, second wave, and it is February 24th. And we're going to do our usual update of reporting out of the numbers from Joanne Gake, the public health nurse, as far as cases she's dealing with today. Chief Burke, what do we have?
All right, good afternoon. 48 active cases, so we do have an uptick from our last report. Some of that's attributed to some congregate living situations that are in town. And then I'm curious to see what happens with February vacation. People coming back if there's an uptick there, but nowhere near the 184 that we had at the peak. Hospitalizations are down also, 15, between the two hospitals, 15 patients and then 4 in the ICU. So we're way down from 56 and 16 back during the peak.
Yeah, so the report out for the cases and what was received Monday, Tuesday, today, they are a younger age group, younger parent group, I'll say. So it wouldn't be unusual. We're going to start seeing numbers escalate, as you said, because of the February vacation, actually. So I know that the school nurses are working on that and tracking down individuals who did travel. Please be aware, if you're traveling, just follow the guidelines. You're not doing anyone any favors. It's rather selfish if you don't, because it's creating a lot of work for the school nurses also. So please follow the guidelines, communicate with your school nurse, respected school nurse, and we can make sure that we're getting your kid back in school in a timely manner. Just a quick thing too, in the county, the positivity rates in the county, it's 3.68%. The town is 3.6%. And basically anything below 5% is an indication of some level of control. So we are lowering our numbers as a county and a town, which is a good direction. We just need to keep following the protocols for that. And just a quick note on travel. You know, travel is allowed. There's guidelines for travel, and we're okay with travel, but if you're going to travel, you need to be okay with the consequences and the protocols. So again, please make sure you adhere to that. And let's do an update relative to vaccination at this point. As far as the town, through Joanne Gake's office, the public health nurse, have been doing the second doses from that first arrangement in phase 1. They're following up on that. What else do we have, Chief?
So we can say with that second round that the congregate housing situation, Sandwich Housing Authority, is done. Sham Heights will be completed tomorrow. So we're, again, on the second round, we're not receiving any first vaccine. We made that clear at the last PSA 15 that the state was going to restrict that starting March 1st. But as of today, I'm hopeful with the Johnson & Johnson, looks like they're going to get their EUA approval, that'll loosen some stuff up. And hopefully we can get back in the game because we're ready to distribute to our residents. Gillette is going to be increasing to 6,000 shots per day coming up, which I just read today. And remember, appointments open up on Thursdays for Gillette. The federal pharmacy program, Walgreens and CVS continue to receive direct vaccine from the feds. We're not sure what's going on in Sandwich with CVS here. We're tracking that down to see if they would be eligible. I know Hyannis and a couple of the locations are. If they are, we'd be happy to partner with them and assist in giving vaccines. A couple quick updates on educators. The Cape Legislative Delegation, led by Steve Zaros, put forth a proposal for Mashpee-born, Sandwich, and Upper Cape Tech educational personnel to be vaccinated at the Upper Cape campus. They have a brand new health sciences building. We've mapped out how that would be done. There'd actually be 12 vaccinators, and we could push through. The numbers are about 2,000 educators that would be eligible. We could push through between 12 and 1,600 in one day with the setup that we have. So Rep. Zaros is pushing through, trying to see if we can secure some vaccine to make that happen, and then hopefully we could replicate. If others wanted to follow suit, we could replicate. We've already shown regional collaboration with public safety. That went very well. And if we can do the teachers, and we're setting it up strategically, if people wonder why we pick dates, we picked the dates of March 19th and April 16th, so the second shot will coincide with the Friday before April vacation. So in case there was a reaction, teachers would have the whole vacation to be able to recover, which is important. And again, the March date, the initial shot date, still about 3 weeks out. We were projecting that we'd be through phase 2, group 2 at that point, 65 and older, which may be ambitious. But we're at least have a plan if the vaccine's available to take care of our educators with shots 1 and 2. The other thing I'll mention on that is the asynchronous learning days, which are Wednesdays. Talking with Dr. Gould, if we can do this vaccine program for educators, they would just flip those to the Fridays. So teachers be able to get the vaccine. So a lot of moving parts with it, trying to do advanced planning. It's not something that you can just pull off in a week, but we are ready to go if the vaccine's available for the educators to be able to take care of that. And then, should I mention the Homebound Program while we're at it?
Yep.
So one of the things that we did ask is to be able to take care of our homebound residents here in Sandwich, and Sue Morancic and the other councils on aging have done a great job in getting the numbers together. It's based on a formula with experience that they've had with these folks, Meals on Wheels, et cetera. But we petitioned the state to get enough vaccine to handle our homebound folks that Susan and Joanne deal with. We already have the mobile unit. We've actually field tested this a couple weeks ago with 6 residences that met the criteria. So we are ready to go if they will relinquish that. We have a ton of support led by Senator Sear on the Cape to get this homebound program up and running for all of Cape Cod. We do have one of the largest demographic of 65 plus in the country. And for those that really can't travel, if we can bring the vaccine to them, that'd be great. And we're probably looking at between 75 and 100 homes, I would think, Dave, here in Sandwich, that we could take care of in a
Just about that.
Yeah,
So,
day period.
just to follow up on that with regards to the homebound, we know who you are. Again, as Chief had mentioned, Sue Mancic at the Council on Aging is aware of it, so we're not looking to take in calls with regards to that. We know who you are, and we will be reaching out when the vaccine is received for that. So the a couple other items being, the state is vaccinating on average 40,000 people per day, approximately. So keep in mind at 40,000, vaccinations a day with the populace of the state of Massachusetts, we'd be looking at first vaccinations done by June, potentially. So with the second dose occurring, finishing up in about the fall, which is about the time frame that nationally they were predicting for full vaccination at that point. That may speed up with J&J getting their approval, but at the moment, we're really kind of on track. So again, I mentioned in the past, have some patience. We'll get you there, and you'll reach that point of being vaccinated. In the works is a mass vaccination site on the Cape. It's still in process. To identify a site that will be coming out in the near future as far as an announcement on that, if that has a direction. Also, we're receiving a lot of calls from people who received their first Moderna shot at the Melody Tent. That was a clinic that was hosted by the Cape Cod Healthcare. I know that a lot of people are calling because the Melody Tent is now being operated by the county and offering Pfizer. So we've just received word that those who received that first shot of Moderna at the Melody Tent through those clinics will be contacted by Cape Cod Healthcare starting next week. So starting next week, Cape Cod Healthcare will reach out to those who had their first dose of Moderna to schedule their second dose next week. And that was just information received this morning on that. And in general, just a quick note too, that it was breaking today that the state has changed their direction relative to distribution of vaccine to hospitals.
Yep.
That hospitals are now going to be receiving that vaccine for their patients and operations and what they're doing there. So if you have an upcoming procedure or something at a hospital, reach out to that hospital or your primary care to see how that works. We have no details on that. It's just that information was just coming out that the state will be resupplying specific hospitals with vaccine.
I think it's the Beth Israel Deaconess and Mass Brigham are the two hospital groups.
Yes, primary groups.
Yep.
So, so they will be providing that now. So there seems to be some little expansion. It's always, the information that we get is daily, probably by the minute.
Yes.
And so it changes regularly. You just have to, have some patience and do your research, and we'll provide you with information, as soon as we can and when we receive it also.
The other thing I'll mention, Dave, as part of the COVID team, because we always look 90 days ahead. I've said this a couple times. So if we play out 90 days, we have town meeting that's going to fall within that parameter. We have high school graduation. We have potential junior, senior prom. So to let folks know, we are in the works and planning all three of those things. Dave's working very hard with Principal Mulcahy and the folks at the school discussing both graduation and some potential prom activity. And then our group's looking at, for town meeting, the first Monday in May, what that's going to look like. It may be very similar. In fact, it's probably going to be very similar to the June town meeting last year in terms of location and protocols that will be followed. But again, we are doing our 90-day lookout right now, and those are some of the things that are on the radar.
So as far as we're going, we've had good practice in all of those, between graduation, town meetings, so.
And any voting. So I think
And
we're in
voting.
good shape. Yep.
Yep, so, we know what to anticipate and kind of start to normalize things a little, if you want to refer it that way.
Yep.
So, those are the plans at this time. Anything else, Chief?
No, I think we're good. We'll be back next week. The Wednesday after that, I will not be here, so maybe a Dave Mason solo show at that point. But I'll be back the following week. And again, just so the folks know, we're working this 24/7, and we're looking to, if the vaccine becomes available again, we would love nothing more than to put our plans back in motion. So we're prepared to do that if need be. But in the interim, do your best to get a vaccine scheduled. I know it's difficult, and like I said, hopefully things loosen up here in the next month or so, and we can provide vaccine to our citizens.
Just one thing to point out too, and to remind people, with regards to vaccination, if you schedule an appointment and you have a caregiver or a driver bringing you to that vaccination spot, that individual, regardless of age, can get a vaccination also. And this is something that was mentioned before. If you have an elderly friend, neighbor that meets that criteria of the 65 and older, and they need a hand, help them register. And then if you can give them a ride to get them up to Gillette, by example, help them out, because you too can get a vaccination on it.
And I think be strategic about it. A couple of my family members have done this, where, large family, and there's somebody 47 with 3 comorbidities and an autoimmune disorder and an 87-year-old. Pair the two of them together in the family and have that person, and it's a twofer at that point. And so you have to look internally in your own structure, family-wise, and almost prioritize who would need what, and if there's the opportunity to get somebody that's a caregiver in there also, that's your opportunity.
Right, so, and that's what we do daily with our program here. Look to who we need to target. Do the same when you look within your family. Good point, very good point, Chief. So I think we'll wrap it up at that. Again, protect your space, be considerate of others, and be safe. Thank you.
Thank you.